Hello there, Millennium Alliance listeners, members, partners alike. Welcome to another episode of the Millennium Live Podcast Technology Partner Series we're doing. I'm Connor Toohey, and I've got a great technology partner here with us today on the podcast who works to make care decisions better for patients and providers, to improve affordability, access, and outcomes, all while reducing that administrative burden that a lot of systems are going through today. I want to introduce and welcome to the podcast Benton Barney. He is the Chief Commercial Officer at Arrive Health. Benton, thanks so much for joining the podcast today. It's great to have you here.
Yeah, you bet, Connor. I'm happy to be here, and I certainly am passionate and love this topic. So eager to dig in.
Great. And so today, Benton and I are going to be diving into really understanding this healthcare affordability crisis, the benefits of discussing costs with patients and driving adherence, strategies that health systems are using and can use to really support price transparency, and really that opportunity of supporting patient affordability. So that's where I want to jump in. And Benton, I want to get your expertise and what you've seen in the field. And really to kick things off, I know this is sort of how Arrive was founded, but every day in present day in the U.S., more and more patients are struggling with healthcare and to pay for it. So, in your own words, and how what you've seen out there, how bad has the healthcare affordability crisis gotten in the U.S. and really how did we get here?
Yeah, wow, how we got here is a roller coaster kind of answer, but I'll do my best to kind of summarize the challenges that we have specific to the U.S. healthcare system that have contributed. But yeah, in terms of how bad it is, I mean, medical bankruptcy is still, one of the number one causes of it. So I think that alone tells us that this is a very serious problem. I think over half of Americans, are delaying therapy due to costs. So, when you have kind of these stats that are being reported either by the census or by organizations in healthcare, it's serious. I mean, 65% of Americans can't afford a copay over $250. Like, with the increasing cost of specialty meds driving costs up, and the changes in benefit design to high deductible plans passing more of that first dollar expense onto us as consumers, we're having a very serious problem. I mean, I think crisis is an appropriate terminology to use in this particular case because nothing is really stopping the trends. I think we talk about other cost management solutions, and I'm sure we'll get into that today, but yeah, I mean, things are truly out of control. And I think our focus on pharmacy is a subset of the overall problem, but certainly one that we're intimate with in terms of the challenges and what we're doing about it. But yeah, as high deductible plans go further, as specialty meds get more expensive, plan design is changing from PBMs and payers, it's only getting more challenging for those who are having other affordability challenges in their life.
Yeah, I know. And you mentioned a couple of great points right off the bat. And so, what impact does affordability and access have on adherence? And just to dive in a little bit to Arrive Health and about what Arrive Health is doing about it.
Yeah, I mean, cost and adherence, they're hand in glove. I think, I don't think cost is all of adherence, but cost is certainly a critical component of it. I've seen reports that have kind of the cost of non-adherence in the US healthcare system costing us anywhere between 100 to $500 billion. It's hard to quantify all the effects of people not taking their drugs, but there have been a couple of organizations that have done a fair amount of research to say it could be upwards of $500 billion, which is just mind-boggling numbers that we're talking about here. How cost plays into it, I mean, it's heavily on abandonment, right? I mean, 64% of people are saying they would skip or delay care if they don't know what it costs. And healthcare is one of those strange things where, when we all go to our doctors, we often don't know what it's going to cost until we get some sort of an EOB from our payer that says, okay, here, Benton, here's what happened when you were at the doctor, 30 to 60 days ago, and here's what it costs. Like, well, okay, you can't really shop that around after the fact. Um, so I think there's a couple different elements. I know that abandonment rates due to cost are substantial and they tie directly to out-of-pocket expense. So I think it was IQVIA that published a study a couple years ago where it said the abandonment rates for zero copay meds is only 5%, but that increases 900% to 45% if the copay is $125 or more. And going back to kind of, again, more of those high deductible plans and more of that expense being forced onto consumers, we see a lot of transactions in our software that see meds higher than $125 out of pocket. I mean, we're running about 10 million transactions a month, and the idea is to bring more affordable, lower cost alternatives to providers when they're prescribing. But yeah, I mean, these numbers are really scary when you really break it down and say, okay, what are people, what's the cost threshold where people just stop going to the pharmacy? And it's kind of around that $125 when you start to get toward 50% abandonment.
Mm. So, this is in terms of Arrive Health and perhaps what you've seen. What are some of the main attractions for health systems to look into potentially using a solution like Arrive Health?
Yeah, a lot of it's really about just removing waste from the system. I think as we kind of inform providers of lower cost alternatives and the patients obviously react well to that because if they can afford their meds, they'll actually get them filled. And then, if we get some creative reminders or other ways to sort of, okay, once you have the drugs in your possession, are you actually taking them according to your plan? Then that's a different challenge. But for us, it's more about tackling that up front. And the waste that happens in the system through abandonment is one, if it's due to cost, there's callbacks to the provider. It's, can you put me on a lower cost drug? I can't afford it. I got to the pharmacy and they told me what it costs and I turned around and walked out the door. That causes problems for the provider in terms of the callbacks, but it also, if there's a prior auth on that drug, it could increase the administrative expenses on the payer or PBM side. But it also creates inventory management challenges for the retail pharmacies as well, as they're processing that order and getting it ready for me when I show up to the counter, and then I turn around and walk away because I can't afford it. That creates challenges there as well. So, we are one of those unique organizations that fits in a niche of healthcare, digital health specifically, that everybody can kind of benefit from. Lowering cost is something that generally everybody in the continuum can kind of rally around, whether you're a patient, a provider, a pharmacist, a payer, PBM, or even a pharmaceutical company. We kind of fit in that little niche.
Yeah. I mean, we have to start addressing affordability and make that a priority. And I love the vision at Arrive Health and making sure that information is there and that, both providers and patients have that information that they can trust, and going into a doctor's appointment, knowing exactly how much you're going to pay helps a lot and makes a big difference. So, we Benton, you've mentioned a couple of really good points, and in terms of affordability and why it's important to address this now. But with the multitude of challenges in the health system today, they're facing a lot of challenges. Why put affordability as a priority? I know that could be a given, but in terms of a provider standpoint, specifically, why should addressing affordability be a priority right now?
I think it goes back to that what I mentioned just a moment ago about how cost is one of those things that everybody is impacted by. Whether it's a secondary or tertiary benefit if you're kind of downstream on the pharmaceutical side or the payer side. But if people aren't staying adherent, they can't stay healthy. So if you're a health system, a lot of this depends on kind of where you are in the general journey, but everybody wins when people are getting their meds and staying compliant with their prescription regimen. The patients save money, the providers save time and avoid callbacks. They can also avoid prior auth activity, whether they're doing it themselves or whether a health system has a central kind of PA processing team. They save time. Pharmacists don't have to deal with the inventory management challenges. Again, this is one of those things that everybody benefits from. So, in terms of why health systems and others should kind of engage with tools like ours now, it's because we are in a crisis and we have a way to truly impact some of that in a positive way by just informing providers and patients of lower cost options out there. And it's just critical that they do so. So now really is the time. And I guess that's my high level answer as the leader, of the commercial organization in the company. There's also some government regulations. This started during the Trump administration around mandates on cost transparency tools being used. So, CMS is kind of getting behind this initiative and starting to really push from their side as well. So there's a compliance angle as well as, frankly, it's the right thing to do for those other stakeholders.
Right. I mean, it's a win-win opportunity for both patients and providers. And so in terms of organizations and health systems on wanting to jump in, you mentioned where they are in this journey. Perhaps they're right at the start and want to address price transparency and this cost crisis. From what you've seen, what impact among health systems that you're working with have you seen in terms of using a solution like Arrive Health? And perhaps if those who are looking for a solution like this, where would you recommend they start?
Yeah, I think part of it is an assessment of just where they are in the journey. With some of those CMS driven, kind of government driven regulations, some health systems put their charge masters out on the web for people to go, see exactly what their costs are for services. Some haven't. There's kind of the where are you, and it relates to things that are out there right now. Most electronic medical record platforms that are in use across the major hospital systems have some sort of a real-time benefit or cost transparency service within their e-prescribing workflow. That's where we plug in. So if that's where you are, is just transitioning into the use of real-time prescription benefit services, do it. It's free. It's fairly easy. Again, most EMR vendors are supporting that capability today. And it's something that can truly bring lower cost alternatives to market. So I think that's sort of the cheap and easy on the digital health side of things. There's a much bigger cultural kind of recommendation I would also make. Changing prescriber behavior and provider behavior in general is not easy. So you kind of have to get executive level health system buy-in to say, hey, everybody, this truly is something that we need to adopt culturally, and it needs to be part of who we are, is to helping our patients afford their care. Now, whether it's medications, whether it's other medical services, it's just something that the health system kind of has to truly believe is the right thing to do. And that comes top down. I would say the third element of that is the elevation of pharmacy within the health system. Sometimes, pharmacy is seen more as a cost center, but there's an opportunity to make pharmacists more front and center in the continuum of care. And, we at Arrive Health, we're big believers in CPAs. That's collaborative practice agreements, kind of helping pharmacists function at the top of their license, get more actively involved in patient care, partnering with, the physicians. And there's a reason for that. If you're on a medication where you're getting 30, 60, 90-day fills, you're interacting with the health system pharmacist a lot more often than you're interacting with your doctor. That relationship between patient and pharmacist is getting more significant through the refill process, and they truly are a key part of the continuum of care. And I think health systems need to support those folks and make them a little bit more front and center. So I think those three things, just cultural buy-in to cost transparency, and the fact that we all have a role to play in addressing this crisis. The digital health side of it, that's kind of where companies like ours can fit in and provide solutions to the affordability issue. And then you have that making pharmacy a little bit more front and center in patient care. I think those are three big primary elements.
Oh, that's awesome, Ben. Thank you. And, I like what you mentioned there. I think those are great, values to have, and really improving the healthcare through more informed decision making. And I like that you mentioned a part of it is just doing what's right. And healthcare and
Well,
affordability should go together.
yeah,
So,
they certainly should. But I think there's also an element of understanding the provider's role in this.
yeah.
doctors obviously care about the health of their patients with rapidly changing benefit design and coverage information that they just can't keep up to date with. There's a fine line between asking your providers to be cognizant of their patients' cost when making decisions on their behalf, and then turning doctors into personal shoppers for their entire patient panel. Like there's a fine line there that we walk very closely in as part of Arrive Health. We're a company that's owned by provider organizations. So they've kind of helped keep us sort of in that zone where the information we're providing is strictly relevant to those providers, and we're not kind of making them feel like they have to go too far out of their way to find the information to keep their patients adherent, but we're also informing them with information that they may not have had before, so they can make the right decisions on behalf of their patients.
Great, Ben. Could you just briefly go into the origin story of Arrive Health? I know there's a good reason why Arrive Health started in the first place and how that's making an impact today.
Yeah, thank you for the question. It's something that we're frankly very proud of. We started as a very patient centric organization, and we live that mantra every day. Our company was founded in an affordability challenge, and this kind of goes back to that crisis that we talked about before. Our co-founder, Dr. Kevin O'Brien, his mother Lucy was having affordability issues with her own personal medications, and she was on a several $100 a month drug spend, and she was diagnosed with an additional condition, had to take another specialty med, and even she was being put in kind of a meds or meals decision making scenario. And fortunately, in her case, she had a son who was a provider, and she asked her son, hey, I need some help here. I can't manage my expenses with these additional drug costs. And Dr. O'Brien did a bunch of research, kind of used his own EMR, used the internet, used a bunch of other tools, and kind of took his mother's drug regimen, and by doing his own research found lower cost alternatives that brought her costs down to roughly 25% of what they were. So for an older person who was on a fixed income, having a 75% discount on part of your fixed expenses on a monthly basis, that's a life-changing event. And Dr. O'Brien kind of said, okay, if my own mother is struggling with some of these affordability challenges, and the only reason she's getting help is because I'm a provider who has access to data, this has to be a much bigger problem. And really, Arrive Health, RX Review, formerly known, was sort of born out of that exact engagement, where a person named Lucy had an affordability issue, and now we've grown into an organization that's helping millions of people in the same way through our network of providers. So it's an exciting place to be. We love our origin story, and everything we do, we kind of take it down to the individual human level and say, how is this going to impact patients? And if the answer is it won't, we don't do it. And if it is something that can truly lead to affordability benefits to the patient, and that allows them to stay adherent and not have to be in that position where they are choosing medications or food, that's why we exist.
That's an awesome origin story, and there's no surprise why Arrive Health takes healthcare personally, especially when the co-founder had to deal with this with his mother Lucy. So that's a great story, and I'm sure that's why it continues to be a big part of Arrive Health with this price transparency and patient specific data in order to help everybody out. So thank you for sharing that, Ben.
My pleasure. No, it's a great story, and again, even though we're all professionals in this industry, we're also all consumers and members of it as well from the consumer side. So yeah, this is all near and dear to me and everybody else on our team.
Yeah, and that's exactly where I'm going with the next question here, because obviously it's tough to change certain ways when things have been done now a certain way in healthcare. I'm curious to know what you've seen out there that's holding some providers, some organizations back from really exploring these options.
Yeah, I think And I'm going to speak specific to real-time benefit and electronic prior auth solutions, because those are the waters that we tend to spend the most time in as a company. When real-time benefit was first kind of unveiled as a capability, 5 or 6 years ago, the quality of the alternatives that were presented to providers, frankly, was not great. I don't think the data quality piece was at a level where providers would look at some of those recommendations to say, don't prescribe Benton drug A, prescribe drug B, here's why. We're either avoiding a prior authorization, or it's dramatically cheaper for me, and the odds of me actually going to it are considerably higher. The quality of those alternatives just wasn't quite where it needed to be. So I think there was a little bit of a trust lost a few years ago when the first version of real-time benefit services were rolled out. Again, this kind of goes back to the benefits of being such a closely provider aligned company, is that people told us very clearly within our board meetings and other situations that if it's more clicks or if doctors lose trust in the content, they're not going to use it. And you've got generally 3 opportunities to build trust with providers. And as a decision support expert who's kind of been in this world for decades, it's true. If your recommendations are not trusted or not therapeutically relevant, providers rightfully won't use it. They'll go with their gut. So we spend a lot of our time and energy and resources as a company really making sure that the recommendations we put in front of providers is truly going to benefit the patient and be something relevant that they should be acting on. So I think that's a big part of it, is just building that trust with the providers.
Yeah. And, with the right technology, providers can be a catalyst for change. And I know that Arrive Health has built solutions to make that impact. And I'm curious because this has been a great conversation, Benton, that I always like to sort of wrap up these interviews in more of a looking ahead type of question, and focusing a little bit on the future. Because as you mentioned, this is a crisis. So if nothing changes, it's only going to get worse. What do you expect, Benton, being in this industry, being in healthcare in the US, what do you expect things to look like a year from now? And if I may be so bold, 5 to 10 years from now, if I know nobody has a crystal ball, but if technology is used correctly, things can change. And I'm curious as to what you think and perhaps see in the future.
Yeah, I think it's a little bit hard to tell. Obviously, I mean, consumerism in healthcare certainly took a dramatic increase during COVID. Telehealth usage kind of went through the roof, and people were, as consumers of healthcare, were willing to try new technologies. I think monitoring of people's health, whether it's through their watches or their cell phones, has continued to increase. And I think the lay person is a little bit more in tune with their healthcare, I would say, over the last 5 years than they certainly were before that. So I think as we look to the future, that's going to continue. And I think as high dollar deductible health plans continue to be increasing cost, I think people are going to be more focused on affordability. They're going to be asking hard questions of their providers, especially anybody who's experienced not just a medical bankruptcy, but anybody who's had to turn around at the pharmacy counter because they couldn't afford their medications. They will be in tune to cost related issues in healthcare probably for the rest of their life after an incident like that. So the first big answer to that question, I would say, is going to be just consumerism in healthcare in general is going to continue on a positive trend up and to the right. I think when you look at the impact that that's going to have on payers and PBMs, I don't know if it's necessarily going to change too much, but it is going to change the kinds of conversations that patients and providers have when they're actually in the middle of a clinical episode. I just think cost is going to have to be front and center in that conversation in a way that it hasn't necessarily been in the past. So getting a little bit more tactical, I think the changes we've seen recently in the number of specialty medications that are kind of in the FDA's approval process, I don't see that changing. I think that's going to continue. There's going to be a lot more specialty meds on the market. Those are going to be high dollar drugs. Payers and PBMs are going to have to, adjust their benefit designs to kind of accommodate that change. Maybe that's going to lead to an increase in copay assistance programs and other affordability programs on the foundation side. Maybe it won't. I think it will probably. Changes in 340B, I think, are going to continue. That's something that most health system pharmacies are very closely attuned to and paying attention to as additional medications get pulled out of that program. That the contract pharmacy part of it, that just means health systems capturing and filling those scripts with their own pharmacies goes up in importance. And I think when I look into the crystal ball, I think for the next couple of years, that's going to just continue to increase. Script capture is going to be a bigger deal. I do think pharmacy is going to be elevated within health systems to be more strategic than it ever has been, which is great. I think everybody benefits from that. And yeah, those are a couple of biggies. I don't know. What about you? What do you think, Connor? Where was I wrong?
No, I think you hit the nail on the head there, Benton. And from what I hear and listening to this podcast, I'm at least optimistic that we have a better future ahead in healthcare. And honestly, with Arrive being a great solution, what we have are patients who can be assured that they're going to get good care that they can afford, and providers that they can be confident that they can make the best care decisions. And from this awesome interview on Millennium Live, for those working to find a clear path to better care, the answer has arrived. So I want to thank our guest, Benton Barney, Chief Commercial Officer at Arrive Health. You've been a great guest, Benton. Thank you for joining. For the members and partners at Millennium Alliance, there is a healthcare providers transformation assembly coming up this fall. It's at the JW Marriott in Miami. That's September 19th and 20th. Benton, thank you so much for joining Millennium Live. It was great to chat healthcare with you. And thanks for joining us. And I can't wait to see what the future holds.
Yeah, likewise. We'll be in Miami, so we'll see you there.